I forgot I had to come on. Thanks, everybody, for joining us on Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. I'm your host, Deirdre Vervo, and today we have a very special guest joining us, Ann Rhodes. She goes by Nancy. She is a certified nurse practitioner who's worked in the home care setting her entire life in New York, now in Connecticut. She's a medical author of a fabulous book called Caregiver Success. Whoops, there it is. And it gives lots of tips and tools from an experienced nurse practitioner. She's a professional speaker, and she's passionate about providing care to the elderly, the homebound, and the disabled. So without further ado, let us welcome Nancy Rhodes. I'm going to go by Nancy, even though you're professional. I know your real name is Ann, but we're going to go by Nancy, because that's what you're called. But thank you so much for joining us. Welcome, Nancy. How are you?
Having me come on board. I'm really pleased to be here, for sure.
Well, it was just such a coincidence to see that you were speaking in Connecticut, and I got a chance to hear you on Zoom, and I was pretty impressed by everything you had to say and all your amazing caregiving ideas, because they're also on video. But before we start that, why don't you tell us a little bit about yourself, your career, how you got into being a nurse practitioner, and what all means to you.
Wow. Okay. So I was a home care nurse in Nyack Hospital and worked for the home care area in Rockland County, if people know where that is, in New York for many, many years, like 20 years. And one day I'm at a payphone answering the phone, and the doctor's on the other end. This is in the 80s. And I'm like describing a wound to him. And I'm saying, it looks like this. It looks like this. This is what. And I'm thinking to myself, how is he ever going to treat this thing if he never sees it? And there was no telehealth. There was no cameras on our phones. There was nothing like that back in the 80s. And I'm thinking, well, you know what? Sooner or later, I'd become a nurse practitioner, because I want to see this rash. I want to treat this wound. How can we take care of people in the home safely and accurately if you don't see the wound? So I went off to school, became an NP in 1999, and worked in primary care and whatnot. And then I realized I needed to go back to the home. I really love the home. That's where the people are. That's where you know how they live, what's in their cabinets. Are they poor? Are they rich? Are they religious? You know, everything about them you can learn by walking in someone's door. And in a doctor's office, you don't see that, or in a hospital bed. But when you're in a home, you see the personal side of a person. So I became a nurse practitioner, and I worked for a few years. And then I said, I've got to go start this company. And actually, one of my patients gave me $10,000 to start my own company. Wow. He says, Nancy, you have to do this. You're going to be great at it. Here's some money for you. I'm like, I guess I need to do this. And so I started the company. It was called Mobile Family Health Nurse Practitioner Care back in 2009, 2010. And I took care of thousands of people in Rockland County for over 9 years, up to the time they died. And I started seeing the same medical problems they were all having over and over if you live long enough. You know, skin tears, urinary tract infections, pneumonia, falling. But people a lot of times don't know that these things can happen to them if you don't show them that it can. Mm-hmm. You know, we're all aging, but we don't know what's going to happen. So I decided that it was time to put some pictures in a book. And I took pictures of my patients. So this picture on the cover is one of my patients and her daughter kissing her. Aww. And throughout the entire book, which is 365 pages, everybody, I just kept writing because there's so much to talk about. I mean, look at this one. This lady's sitting in her chair. Whoops. And it says, eat, drink, and be merry. A body in motion stays in motion. And I took a picture of her because the son put that up on the wall in her bedroom.
That's great.
So half of the book is really about getting ready. Mom's moving in. She doesn't come with instructions. You know, and we don't come with instructions. So we carry this body all our lives, but what do we know what the pancreas does? You go to the doctor's office, he says, you got a bad pancreas. Well, what does it do? You know, what the point is that you could read this book at the age of 40 or 50 and start saying, wow, my mother had this. Genetically, I might have this. Let me see how I can prevent and have a better quality of life. So the first part of the book is really about structure, finding a good aide, learning where you're living, getting your support groups together, getting your equipment, whatever for mom. And then the second part is all about the medical problems you can run into. And it's 14 font. It's very big. It's easy read. It's supposed to be for anybody who can barely speak English so that they can like slowly understand through pictures and stories how to take care of themselves. I loved writing the book. It took the 3 years to write it. It came to my door right before COVID hit. February 20th, 2020, 50
Wow.
books showed up at my doorstep. I had all this stuff arranged to do some talks, get the book out there, and everything, as you know, shut down, right? Everything did. March 15th, 2020. And so, I found that the book will go somewhere, but the funny thing was I started YouTube videos a year earlier. And I know that people learn by reading, but sometimes people learn by watching. And sometimes people learn by watching over and over again. You can put a whole new motor in a car by just watching YouTube. Well, I naively did a video on how to use a Hoyer lift with one person. And to me, that was a no-brainer. I had so many people who lived alone in their homes with their daughter or their husband and had to get out of bed, and they had to be taught how to use it themselves. So one of my first videos was, how do you use a Hoyer lift with one person?
Wow.
So
you know what is quite remarkable? That you did those videos during COVID, right?
I did them before COVID.
Oh, and then did you add to them during COVID?
Oh, yeah.
Because
So it evolved.
you were telling me how you got so many hits during COVID because people were home and couldn't bring people in the home, and you had people all over the world watching your videos.
Well, that one in particular was funny because I just put a tripod across the room to make sure my head wasn't cut off, and I had no one filming it, and I just opened the curtains in this lady's house and filmed getting an aide in and out of bed to a Hoyer lift to a chair. And I still get 1,000 views a week on that video.
That's crazy.
I got 150,000 views on that video, 10-minute video, during COVID. Who would have known? And people all over the world were like saying, Nancy, with broken English, thank you for showing me how to get mom out of bed.
Oh.
They're like, there's things in the corner. There's no aides. There's nobody coming here. We're in Pakistan. We're in Fiji. I got one from Fiji Islands.
Amazing.
And I'm like, well, okay, I guess I got to keep doing videos. But those were April 2019. So here's our timeline. April 2019, I started the videos. The book is getting made. The book comes out. COVID hits. And the videos start getting a lot of traction. One I did on washing your hair in bed with roll towels and, nothing fancy. And a mother wrote to me, Nancy, my little boy is in a spica cast and he can't get in the shower, and you showed me how to wash his hair in bed. So what happened to my book, which was supposed to be for baby boomers, and I'm a baby boomer, and how are we all going to take care of ourselves as Social Security runs out, and it's going to be a lot of us. 86 million of us by 2030 over the age of 65, which is going to be a lot of people. And it's either some will not be here, but many will try to survive it. But how do they prevent medical crisis? Just the other day, I called my neighbor to check on a friend of ours who's 95. And he says, oh, she went to the hospital. I'm like, what happened? You guys play cards every week. Well, she got constipated. She got impacted. She had to go to the ER. She had to get disimpacted. She had to go to rehab. She's coming home tomorrow. It's been 2 weeks. And I'm like, but Pete, I gave you this book on page 4. You can learn all about constipation. Has anybody got a chart in the bathroom? Is anybody keeping a track for her? And her daughter's a nurse, but she doesn't live there. And maybe your mother says, yeah, I'm doing fine. Mary, I'm doing fine. So you have to have tools to prevent that unnecessary emergency room visit for something that could have been prevented. And that's what this book is filled with.
So funny you say that, because one thing I love about the book is that you have it all so spelled out. Like what you just said, constipation, page 144 is right here. Like you can look here and see, like if your hard of hearing is wax, head injury, like it's a reference. You don't have to sit here and read hundreds of pages. You can refer to where your interest lies or what your issue is. So it's a great book to have for any family member, any caregiver. And I have this at my home. I brought it back today to be on the show with you. At my home with my caregivers because they don't all know what to do about everything. And like you just said, we want to avoid emergency room calls, and we want to avoid people being, having UTIs, especially, and constipation and dehydration, and very kind of simple, but things that are often had with seniors. It's either constipation, dehydration, or they have the runs, or they have a bruise from out of the blue. So what do you do not to panic? Like, what do you do to fix it? So this is such a great guide. Or if somebody says they have a stomach ache, what could it be? What do they eat? Tracking things.
Yeah, things are not. Yeah, things are not zebras in the woods. They're squirrels. That's why I said that when we were talking. When you think about a problem, it's not going to be the worst thing ever yet if you take it step by step. It's when it gets and explodes in our face, when pneumonia gets to be bilateral pneumonia, and now all the lungs are involved, and you need to address the first thing. So that's important to know. Also, there's an ebook, which is a little you put on your phone, and I imagine the ebook being the daughter in Oklahoma who has it, and the aide sitting at the bedside. And she says to Mary, the aide, can you look up what Nancy said about this? And you look it up that way. I can see a nursing student. Actually, a nursing student just bought my book, and she says, this is years of me thinking that I will never learn until I reach like 20 years of nursing.
Well, what's funny, Nancy, because, we have CNAs on staff, and they don't know a lot of this stuff. This is not taught to a CNA. I mean, I'm sure it's taught if you're a nurse, but this is not taught to a CNA, and this they do a 1-month training. So all this is such important information they need to know because it's practical. Like they get to a job and then they don't know things basic, but they're not all taught.
No, well, there's things like putting tape on your skin. If you're not supposed to put tape to hold a bandage down or a dressing down, put a little cling around and then put the tape on the cling because people have such tender skin. I have a whole chapter on putting socks on hands. Socks on hands are wonderful. You cut them up and you put the thumb on, and the people with the petechiae on the arms, they will not break open. And people knew Nancy was there because everybody had socks on their arms when they came. They were pretty socks, polka dot socks, zebras.
I saw you do that demonstration. I saw you do that video. So what are your best videos? So the video of Get a Hoyer lift, that's surprising so many people have Hoyer lifts in their house. To me, it's surprising.
All over the world, they are everywhere.
That's crazy. Yeah. That's a big to do. That means the person's bedridden. But what else? What are your other top videos?
Believe it or not, ASMR, which I did a video on how to clean your. Okay, so during COVID, I kept doing videos. I took people for walks in the woods of Newtown, by the way, and people would tell me that's what snow looks like. And I'm stuck on a 17th floor apartment building, and I'm just going to watch you walk.
That's fun.
Snow. So I started doing a video. I did one on cleaning your nebulizer mask, and I put it on and I showed them how. And it turned out that is something called autonomous sensory meridian response. And a lot of people in other parts of the world use it for anxiety to help them get off the bridge, so to speak.
Nebulizer mask?
It's white noise. It's muffled talking.
Okay.
So I did some videos on that, and I got all these people in India. And who would have known? So it was taking me down this other path, but I kept bringing myself back. No, I got to keep doing how to adjust your cane and how to use a wheelchair safely and those kind of things. So everybody can get this book on Amazon, or they can go to caregiversuccess.com, which is my webpage, which is easy. You can go there. It's in an ebook. It's in a big book like this. I'd love you to join me on my channel, Caregiver Success. All you do is go to YouTube and click on Caregiver Success. I just did one on Vero Beach. I'm sitting on the beach talking about, stress management. I'm like, you don't have to be on a beautiful beach like this to take yourself in a good place. You could be in the city on a bench. You could be on a rock in the woods. So I keep taking you with me everywhere I go. I have videos of me on the top of a boat doing stretching in the morning. You got to stretch before you take care of somebody, including yourself.
So you are like an international sensation now. You're an influencer.
I'm working on that.
You're a caregiver success influencer. So you are all over the world teaching people how to do things at home and teaching nurses and caregivers and CNAs and all over. And you're going to continue doing that, I guess, on YouTube, on your video, with your book, everywhere else. What does the future hold for you?
Well, I just turned 65 last week, and that means Medicare and how to navigate the senior. I found out how Silver Sneakers works, and I can go anywhere for nothing, and I've got a card for.
What are Silver Sneakers?
Silver Sneakers is free gym memberships. On your phone, you can in the morning do a cardio class. You can do a yoga class. They're all for free because you're 65. You see, they want the baby boomers to stay well because there's going to be a gazillion of us.
Yeah.
And so anything they can do to make us stay active and get what we need, and some of it's freebies, will be great. So I'm going to do a video on getting my Medicare card and how to pick a good secondary insurance to meet your needs and your.
I think that is so complex and so necessary.
Well, you know, as you're getting, I mean, why can I can't do this to people if I don't tell them what's going on with me. I've done a video on osteopenia, and I showed them my own T-score and how to read your bone density. I'm like, this is my bone density. Go look at yours. So the videos are becoming me getting old with the people, you know, older. And I think that's only fair. You can't just, you know, you got to let people know that you're human too, and that you're going through stuff, and that how did I navigate? I'm doing just like you, but I'll give you some extra pointers. You know,
I think it is so important to talk about Medicare.
Oh my gosh,
it's so confusing, and I know so many people that have run into so many issues with it because they didn't understand it prior. My best friend's mom is in her 90s, and she never took the
Part B
prescription part.
Oh, the prescription part.
Because she was totally healthy at 65 and 70 when she had to choose.
But you can change it every year. She did not know that. Every year you can change it in enrollment time.
She'd have to go back and pay from 65 on because she didn't choose
that. Okay, so I have a secondary insurance, and that has my dental, vision, and my prescriptions. So I made sure I got a PPO that has all that. So believe me, you have to kind of,
You have to know things.
Well,
I always say that you have to know things.
You do have to know things. And another thing that's in this book is everybody should have a healthcare proxy. You know, everybody over 18 should have a proxy. You just never know how I'm going to do one on cremation. We just cremated my husband's parents. They had a plan. And when they died, the cremation people were called. They came and found them, and they took them, and they did everything they needed to do. What I'm saying is that reduce the burden of your children as much as you can. Make your own decisions so that they don't have to fight over what to do for you. If you've done it already and paid for it, what else do they have to do? Just get on the phone and call the person.
Nancy, that is so true. And, you know, my father-in-law, who didn't have any money, he in Rockland County, we happen to be from Rockland County, which is pretty coincidental. But my father-in-law was my stepfather-in-law, had me in charge of his will and his death. And he donated his body to Westchester Medical Center.
Cool.
So they came, let us say goodbye, and they were going to take it for science, and they'd give you the ashes like 2 years later. So I called them, living in Connecticut, saying, I want to donate my body. I thought that was a great idea. They wouldn't take it because it was a different state, but Yale will. So if anybody wants to donate their body, it's a free cremation. And you're doing good because you're giving your body to science and for medical students to, you know, research. And they give you the ashes 2 years later. They come pick up the body. It's all free. It's all great. You have to do that before you die.
You have to sign the papers and get that done.
Yes. Your family can't decide, oh, we're going to ship you to
Yeah,
you.
you have to have things in order. That's a good one. Maybe I'll do that with my body. My
Yeah, no, it's
my
great.
twin sister's doing that. Her and her husband, because they're pretty poor, so they don't want to have to deal with cremation and all that. So they're donating their body in North
Well,
Carolina.
so my father-in-law did it because he was poor, but I'm doing it because I think it's a great idea.
I think it's a great idea.
Because they knew, you're a nursing student, right?
Yeah.
When you're a nursing student, they need cadavers,
Yeah.
and they need them in good shape, and they need to come get them. So you need to do that prior to dying. So I do have that with my healthcare proxy, with my, trust and
That's
everything.
really good information. I'm writing that down right now.
They'll do it in Connecticut, Westchester Medical in New York will do it.
What happens if you move to another state? Do they come and get you?
No.
See, that's what they did with my mother-in-law. She died in Pennsylvania, but she was from Florida, and they went to the hospital and got her. And 2 weeks later, we got her urn that she picked out at our front door. It must be a company that's all over the country, and that it was your turn.
She didn't donate her body to science.
She didn't, but what I'm saying is that would be the problem,
Oh, yeah.
People.
True. So you have to have plan B.
Okay.
Because, you cannot they come get you in Connecticut only. So you can't be on vacation in Hawaii. They're going to get you just in Connecticut if you do it in Connecticut, just in New York if you do it in New York. And you can't have an infectious disease, and you can't be like mangled in a car accident.
Yeah.
But it's the chances of you dying just at home are pretty high.
Yeah.
And not of an infectious disease and not of like a mangled car accident. So I thought it was a good to do.
That's a really good one. Yeah. You're not leaving Connecticut then. I plan on
going on vacation again, just in case I die. No. So yes, you do. There are stipulations. You do have to be. But if you die of regular causes when you're 100 years old and you're sitting around home, then they'll come get you.
Yeah. Well, I just want to make sure I answered anybody's questions. Do people ask questions or call in, or is there anything like that, or?
We don't have any questions going on.
Okay.
But I think everybody knows that you're caregiversuccess.com.
Okay.
Go by Nancy, the NP, 845-641-7277.
Oh, you can also email me. If you could also email me if you have a question. People email me all the time from all over the place. nancythenp@gmail.com, which is really easy. And then that way you can even
at gmail.com.
Yeah.
You must be answering questions all day.
People email me from Egypt and ask me stuff, and I'm on Invacare and I'm helping them find stuff. And I'm like, you know what? Let me just help you.
That is amazing.
That's what you do. The world has become, a community is now the world. We're all aging together. We all speak different languages, but we all go through the same thing, all over the world.
Do you know what? I was in real estate before and advertising before healthcare, and the healthcare community, and you're just exemplifying it. It's like one big hug. Like everybody is so caring and so nice to each other and just wants to help, and everybody it's like beautiful. It's going around like Egypt and India to see the people that you've helped online, meeting them. Like it's just such a loving community, and I love it. And you did a beautiful job with this book. I mean,
thank you.
It's really comprehensive. There's so much information.
Thanks. I tried to keep drugs and anything that was futuristic out. That would be, except for the usual Lasix, which will never go away. But, there's no biologics. I didn't go into anything about that because I wanted the book to be timeless. In other words, a skin tear is a skin tear, no matter 20 years from now.
No, it's really great. And you did a great job. So kudos to that. And
thank you.
Read Nancy's book. You can write to her at Nancy, the NP, if you have any questions about anything.
Yeah.
Help.
Yeah, guys. Do that.
Go online, get her book at Amazon, or find her at caregiversuccess.com. You have so many YouTube videos. So
yeah, I'm up to like 125. I'm just going to keep going. I'm doing one on an anti-choking device, de-choking device tomorrow to show you guys that everybody should have one of these in their home.
What's an anti-choking device? Oh, give us a heads up.
Okay, it's called LifeVac. It looks like a toilet plunger. It actually is in a little plastic bag, and if you're home alone and you're choking and you really can't get over the chair and get that hot dog up, You put this device, which is like a mouthpiece, like you would have to resuscitate somebody. It has a plunger on it. You push it and you pull, and it sucks it right out of your throat.
I should
It's,
get this for my home, right?
it's. I'm gonna have one for my boat. If you're out in the middle of nowhere choking on a candy, you're done. It's a really, really cool thing. It's called Life Vest.
Where can you get a life back? Amazon?
You could look online. I have a man in Connecticut who can get a bunch of them for us. So I could tell you more about him. But I keep finding these cool things. One of the things I wrote in my book I was finding is people were using things like I told you about the parachute material. You could pull somebody up in bed if you just have something slippery under them, and they could weigh more than you. They make these parachute material chucks that actually will slide the person up the bed and with no friction. And I had to put it in the book. I'm like, there's so many good gadgets out there that are not a lot of money, really great. They do the job, and they help your back, and they really prevent trouble. And that's why I'm going to do the Life Back one. I love the idea of it. It's a great.
I'm gonna go online and order that tonight. I mean, there's so many. I mean, it's it's great. I mean, you're a nurse forever, and you have so
I feel like it, yeah.
well, but you've been a nurse forever. So
Yeah.
anybody that's just at home with their parent, they're not that may not be nurses.
Yeah.
They don't know any of these things. So you putting it all together and also giving them tips because you've researched it as well and added things to it. It's life-saving. It can really save somebody's life.
Well, if you guys can think of a video, actually, we're doing something on strokes, and next month is Stroke Awareness Month. And one of my patients on my YouTube said, Nancy, would you do one on strokes? So I will put one together on strokes. And that's a biggie. It's in the book, but I like to kind of give people tools to use. Another thing that happens on my YouTube is after I'm done, I do a PDF of a take home, which is on my facebook.com Caregiver Success page, like a proxy that you could print out, and there's your proxy. Or a little stress pad. It's a little, what do you call it? It's a little pal you carry in your pocket, and you open it up, and it tells you 10 things you could do right now to unstress, stretching out your hands and just stuff. And it's pictures, and just stick it back in your pocket. It's a pocket pal. Print it out, and there you go. You got
everything. You're thinking of everything. I love it.
Yeah.
You're like one idea after the other. You're like, well,
yeah.
I'm definitely going to go on and get that Life Back. And I have perused the book, but I will read it in full before I give it back to my home to look at. They have earmarked some things here, which is nice to see that they're using it. But I would just like to know, because I have no idea about anything about nursing. So it's all pretty cool.
Well, I do want everybody to check out my YouTube and subscribe to the channel, because I'm finding out people have younger children that are smoking and drinking a lot of soda, and then mom had osteoporosis. And how are you going to help your children? Watch the video, help them, because if you could put 20 years back on these people, you can get to 60 or 70 and actually be able to touch your toes still. If you just kind of take care of yourself. I mean, this is all we get.
So are you saying that drinking soda and smoking cigarettes are the cause of osteoporosis?
Oh, no, but I'm saying that smoking does have a reason. They say soda is replacing the good foods, the fortified calcium drinks, and that's what you're doing, is replacing it. So that's why you get it, not from them, but because of things that you're doing, and sedentary lifestyle, not moving off the couch, not taking a run, weight bearing exercises. Bicycle doesn't work. You got to jump rope. You got to bang on the floor with your feet,
Interesting. I read a survey saying that there are more Americans that drink soda, like Coke or Pepsi in the morning, than coffee or tea.
I can agree with that.
We were never allowed to drink soda as a kid, so I never got in the habit of drinking soda. I never drank soda.
I never had soda either. Well, the caffeine. It's the caffeine.
Yeah, but there's zero health benefits in it.
Absolutely, and it's actually got like 900 grams of sugar. It's really bad. It's been a really bad problem. Soda.
Yeah.
So that's good that you're not drinking soda.
Yeah, or never smoke. There we go. So now I don't
And
have
I never did that either.
osteoporosis.
Yay for you.
Thank you so much, Nancy, for coming on. I hope to meet you someday soon since we live so nearby.
We would love to see you. We'll have to
Super.
see your house too in Stanford,
Okay, well, you'll come visit it. It's up in Shelton, so it's not too far from you.
Oh, in Shelton. That's right, not Stanford.
So that's okay. We'll come visit. Well, thank you so much, Nancy.
Thanks, everybody.
Anybody can just get in touch with Nancy, subscribe to her YouTube, go on Amazon, get Caregiver Success book, go on caregiversuccess.com. 28 ways to get in touch with her. Call some people in India who she's helped,
So,
hello. So much, Nancy. We will
Thank you. Thanks for having me on your show. Bye, everybody. Take it easy now. Stay.
Oh my gosh. She's such a live wire. I love her. So Caregiver Success, such a great book to have at home. It's one of these books that you want to have around because you can refer to it. It's not just for the elders. You can refer to it for all different things that go on just medically. That, when you're home by yourself, it's good to know for your kids, for elder people, just interesting information about just even fiber and magnesium. And it's great. You'll love it. So please go on her website, caregiversuccess.com. Subscribe to YouTube. She has tons of shows there. And, you could see how to do everything for yourself at home. Well, that's it for today. So thank you so much for joining us again on Let's Talk Seniors, Memory Care Issues, Alzheimer's, Dementia, and Parkinson's. Till next time.
Hi, Deirdre here again. Thank you for joining me on Let's Talk Seniors, Memory Care Issues. Is this an issue hitting home? Do you have a parent or loved one with memory care issues who you feel is not safe at home anymore? Are isolation, falls, and safety issues becoming a big concern? Welcome to Dogwood Senior Home, premier boutique residential senior living specializing in memory care. It's country living at its best in the Huntington section of Shelton, Connecticut. Senior residential homes are concepts sweeping the nation with 47,000 across the U.S. We're pleased to open Dogwood Senior Home as it will be only number 6 for Connecticut. Brand new, sparkling clean, and safe. We are COVID-free. Residential care homes boast a very low COVID infection rate across the nation. This is due to the intimacy of size and speed in which the caretakers can shift to accommodate immediate needs. They are much safer than the large homes and facilities, as you can imagine. It has been documented that residents have less falls and a better quality of life in a residential home environment. Our home is more affordable than the big box facility. You pay one all-inclusive price, and that price is guaranteed for the life of the resident. With an incredible 1-to-3 caregiver ratio, which you won't find anywhere else. Our friendly, loving caregivers are dedicated and trained in Alzheimer's, dementia, and Parkinson's issues. Call me at 203-689-7562 for a talk and tour. I would love to meet you and your loved one. See you soon. Bye.